Hello, my name is Sam Hoffman, and today I'm going to present to you on DYT1-TOR1A Dystonia. So what is dystonia? It's a movement disorder, which is neuromuscular, and it's basically characterized by involuntary muscle contractions. There are several different forms of dystonia, a handful of which are genetic, but it can also be brought on sporadically, for instance, from a reaction to a medication or just some foreign substance. It's a very common side effect of antipsychoactive medications. But today we're going to talk about some of the genetic forms of this. It is currently incurable, but there are several treatments which help alleviate symptoms pretty well. As you can see in this picture here, DYT1 is characterized by a lot of cervical torsion, a lot of contractions in the torso here, and in at least one limb. So in terms of treatment, initially when someone is diagnosed with dystonia, especially DYT1, the provider will first try to prescribe muscle relaxants. The least invasive treatment, it can help with milder cases of dystonia to basically just relax the muscles and provide some relief to patients. If the dystonia progresses further and muscle relaxants aren't really doing the job, then patients can receive quarterly Botox injections. So that'll be really effective in the cervical muscles and sometimes in limbs, especially the legs. However, if a patient has progressed and need clinical Botox, they will likely eventually need deep brain stimulation surgery, which includes sometimes bilateral implantation of neurostimulators actually into the brain, and they're connected to batteries in subcutaneous in the chest. So I will show you in this next slide the actual layout of that surgery. And that's actually a picture of me on the left. I chose this topic because I have a personal relationship with this disorder. I was diagnosed with DYT1 dystonia about 10 years ago, actually. 11, actually. And 10 years ago, I did have the deep brain stimulation surgery. And it's helped me a lot, actually. If I did not have that surgery, I would still be getting clinical Botox injections, but when they wear off, it would be very hard for me to function if I didn't have that surgery. So as you can see, here's the implantation of the electrode. It goes right down to the globus pallidus region in the brain. Here are the leads, and connected behind the head into the chest here. Just a little context there. So what causes this specific form of dystonia? DYT-TOR1A is characterized mainly by a mutation in the TOR1A gene. It's on chromosome 9, and while there are a few different mutations that can cause this disorder, the most common one is a 3 base pair deletion on the 5th exon of TOR1A, which results in the loss of one glutamate. So it's interesting that the loss of one amino acid would cause such a exacerbated disorder. This gene encodes for the protein portin A, which I will discuss on the next slide. The portin A is a member of the family of adenosine triphosphatases. These are basically the molecules that are responsible for hydrolyzing the bond between ATP, with the last phosphate bond on ATP, which, when that bond is hydrolyzed, results in ADP, adenosine diphosphate, and energy. So these molecules are able to actually transfer that energy, so it's not just lost as heat or dissipated into the rest of the cell. So the exact role that TOR1A plays, or the mutated TOR1A plays in manifesting DYT1 dystonia, is not really understood. Through experimentation, scientists have seen that this mutated form of TOR1A, it changes the structure, obviously, a little bit, and that results in decreased binding capacity for two activators of this protein. So it does have decreased activity in the cell. They're not sure exactly the full reasoning behind that, but it is thought to be a loss of function mutation. And there's still a lot of research being done on dystonia, especially DYT1-TOR1A. So it's probably one of the most popular forms of dystonia. So here's just a little diagram of the entire gene, TOR1A. And right here you can see is the deletion, the glutamate deletion at position 302, 303, which does result in the mutated TOR1A protein. So DYT1-TOR1A is autosomal dominant mode of inheritance. It has a much higher prevalence in Ashkenazi Jewish populations. Same thing as Tay-Sachs and Creutzfeldt-Jakob disorder. Interestingly, this has varied penetrance. So most patients who are diagnosed with DYT1 dystonia are going to be carriers. And only 30% of carriers are, on average, are affected by the disorder. So here's a little pedigree, actually. The first three lines, the first three generations, are actually my family, pretty accurately, like from here above. So here I am, being affected with the disorder. And the only other person we know in the family who retrospectively had the disorder was my grandmother, Phyllis. She would have, well, let's say she was never actually diagnosed with dystonia. However, looking back, she exhibited a lot of involuntary muscle contractions and kind of strange movements often, growing up, not even before she was too old. So she was affected. We believe that my mother was a carrier as well, but because of varied penetrance, she did not exhibit anything. My brother does not have dystonia at all. And looking down here, I would have a much higher chance of producing offspring with the disorder. So I will definitely be looking into prenatal testing and genetic testing, and probably in vitro fertilization if I do want to have kids of my own. Which leads to my next point, testing for this disorder. So the testing is pretty straightforward for DYT1 dystonia. It's a blood test, and those cells are then amplified. Well, the gene in that cell is amplified with PCR for 1A, and they're just looking for that signature 3 base pair deletion, which is pretty conclusive to tell whether one has dystonia or not. And this often isn't done as a screening test. It's more so a diagnostic when somebody comes in with symptoms and they believe that they're manifesting dystonia. So it's often done to rule out dystonia as opposed to any other neuromuscular disorder. Test is pretty widely available. It's not hard for me to get the test when I was thinking that I was diagnosed. Yeah. And on average, it costs about $588. Not too bad, especially with insurance. So I hope you all learned a lot about dystonia today. Here are some of my references. And thank you very much for watching.